Our topic of presentation is euthanasia. Euthanasia means the practice of intentionally ending life of a patient to eliminate suffering or special pain. This is to reduce suffering or special pains which may cause like lengthy suffering of patients, or may cause huge bills to hospital for patients. Here we may go to the special purpose of our topic. This is to inform our audience about euthanasia. That's also the central idea. Although euthanasia is regarded illegal in many countries, it reduces suffering of the patient from chronic diseases. Our main point of the topic is the syndrome, the main point of the topic is advantages of euthanasia and disadvantages of euthanasia. So let's look at advantages of euthanasia. Euthanasia, the first point is it reduces pain and suffering of the patient. This is when some diseases may show lengthy suffering of the patient. So euthanasia helps to reduce the suffering in order to reducing the pain and suffering of the patient. Number two, it will also provide psychological reassurance to dying patients to avoid fear or misunderstanding. Number three, euthanasia is also used as the last resort when all other options are off the table. When, for example, we can say that sometimes diseases may lack cure, which after lacking cure, we can say that euthanasia can help the patient, can be the last resort or option when all other options are off the table. Number four, death is inevitable in one way or another. Therefore, euthanasia is only a way of death, but death is inevitable. Number five, euthanasia is a personal choice rather than the one the government mandates. Therefore, the patients are given the right to choose death rather than being forced to by some individuals, government, or the doctors themselves. So at this point, let's look at the disadvantages of euthanasia. So number one, doctors have a minimal role in the modern euthanasia process. This means that the doctors are not given an option to explain to the patients their time of suffering, their time, and also they may not be intervening in the process. Therefore, only the patient and the relatives of the patient are there to be involved in the euthanasia process. Number two, prediction of a terminal diagnosis may really not be accurate because some diseases may tend to have long suffering, or may take long to heal, but eventually they may heal at the long run of the disease. Therefore, sometimes the doctors may recommend euthanasia while the patient may recover at the long run. Number three, it could allow people to choose death for reasons that go beyond illness. This is, for example, some patients may be ill because of a reason that the disease is not really natural, but may be caused by something else. Therefore, the patient may choose to die because of other reasons that are not really associated with illness. For example, depression, stress, or other related issues. Number 4, some doctors may purposely give out false information than the reality of the health of the patient, therefore giving an optimistic time that may be more or less than the time the patient may live. Number 5, most patients do not go through with the process of euthanasia. This is because when the doctors or the relative recommend for euthanasia, they may not really appreciate it, because they may tend to have a belief that they may live longer, or they may at the long run, at the end of their suffering, there is always cure for their disease. That's the end of our presentation. Thank you.